Gaza's health ministry has warned about 20,000 patients trapped, unable to leave for treatment abroad. We've been talking about that, and that includes 4,000 people suffering from cancer. This is Al-Aqsa Hospital in Deir al-Balah, where kidney patients are hoping to leave for Rafah. More than 1,200 patients have already died while waiting for permission to travel. Only 3,100 people were allowed to leave Gaza for treatment since Israel shut the crossing nearly 2 years ago.
The crossing is a lifeline for Gaza. It is a lifeline for us, the patients. We don't have the resources to be treated in Gaza. We have to go outside in order to get the treatment. This is the machine of slow death. We have to go outside to continue with our treatment journey.
I'm really happy that the crossing will be opening after 2 years of war. When it opens, I'll go for a kidney transplant and hopefully I'll return back and be recovered.
Joining us from Al-Mawasi in Gaza is Claire Nicolet. She is the Doctors Without Borders Emergency Coordinator in Al-Mawasi. That's in the southern part of the Strip. Claire, do you currently have patients who are on the list to leave through Rafah for medical treatment, or who hope that they will be able to leave soon?
Yes, indeed. We have patients that have been registered through the long process and complicated process, and now we'll see when and how they can move through this crossing being open tomorrow. But we already know that, of course, it will be very slow and not so many patients are ready to go out.
How is it working on your end? What steps do you have to take?
So, as I mentioned, indeed, it's very complicated process. So it means that you need to be registered through Ministry of Health. You need to be registered also through the Ministry of Health in Egypt. So there is also a discussion with Ministry of Health in Egypt. And of course, you need a third country to be able to take your file and saying that, yes, I will receive this patient in my hospital. So it means it's lots of different steps to be already in the list. And then, of course, it will depend one after the other. They will be called to get out. So it means that, unfortunately for the patient, it has been already a long waiting list and a long time that they are waiting for some of them. And of course, they are not sure if they will go tomorrow or they will go in 2 months or when they will go.
Can you give us an example of a patient for whom you think this is going to work and who will be able to leave soon through Rafah, and perhaps a counterexample of a patient for whom you just don't have that certainty or for whom you know it's not going to work?
So basically, this is the main issue, because we are not sure who will be receiving care outside and who will be able to cross. But most of the cases that are accepted are children. So we know already when you are an adult, it's very difficult to be accepted and to cross. And most of the cases that will be referred and transferred to another country will be mostly trauma patient, or they will be so wounded, or they will be cancer patient. That's the most common cases that can go. Everyone who is adult is way more difficult, and most of them, they will not be able, even if they need urgent care and care that are not given here in the Gaza Strip, they might be refused indeed.
Yeah, so your information is that trauma and cancer patients are going to be prioritized. Let me give a little bit of context to our viewers on the medical situation in Gaza, which has been crippled by 2 years of war. The United Nations says that more than 60% of primary health centers and hospitals across Gaza are currently non-functional or have been totally destroyed. The most critical drug shortages are in emergency services, particularly in IVs, antibiotics, and painkillers. There are no functioning MRI machines. Only 6 CT scanners are available across the Strip, meant to serve around 2 million people. And there is only one cardiac surgery room that is operational. So with that context, Claire, back to you. What are you missing the most on a day-to-day basis?
Working on the proper way, especially as it was more than 2 years ago, that meaning that there was really nice hospitals with really good quality of surgeries. What we are missing now, it's obviously lack of supply, because unfortunately, since 2 years, we are receiving just little by little the supply from outside. We have many surgical material that are missing, for instance, and the one who are really very necessary because we have lots of fractures, for instance. So we have what we call external fixator that puts on the legs, for instance, when you have open fracture. And this, for instance, it has been really very difficult since the beginning of this war to receive them. So this is kind of thing that is very basic, I would say, and we are missing a lot. Obviously, we are also missing a number of beds. So now there are very few hospitals, as you mentioned, that are still functional, and they are partially functional, most of them. So there are not enough emergency department. There are not enough operation theaters. There are not enough, basically everything. And also what we are doing is that, of course, we are prioritizing no patients because it means that the more severe will receive treatment. But I don't know, chronic patients, for instance, for them, it would be even more difficult to receive treatment. So we are basically missing still everything for doing good quality of care
Claire,
up to now.
Claire, you have another problem, meaning that MSF has another problem. Israel just announced that your organization, MSF, must cease operations by the end of this month after refusing to hand over the names of MSF's Palestinian staff to Israel. So does that mean it's going to be the end of the road for MSF's operations in Gaza?
So yes, this is another very big issue, obviously, for MSF and mostly for our patients, obviously, that indeed we have not received the new registration that Israeli authorities asked us to re-register because we were registered. And unfortunately, we had this new procedure and they asked us the list of staff and we refused to give them because there was no guarantees on the security of our staff, how the information will be treated. So though we tried to discuss with Israeli authorities and unfortunately we didn't receive any feedback. So indeed, we don't want to go to the end of this registration process. And then they said we have to stop by the end of this month. It's already started since 1st of January that we cannot have supply entering in our name, MSF, because we had this situation pending for registration. So we are very worried because unfortunately, we don't know how to operate after that. We are supporting more than 20 health centers at the moment. MSF is quite has a very big footprint here in Gaza, and really it will have severe damage for our patients and the population in Gaza.
Yeah, Claire Nicolet, thank you very much for joining us on the Al Jazeera News Hour.
Don't miss out and get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.